The mutation is an expansion mutation, and what that does is to change the ability of the body to develop after you're born. So normally you're born with a set of proteins that allows you to function as an infant. And of course those proteins are very different than the proteins and other features that you have as an adult. So this transition from being an infant to being an adult is very important in your maturation and your proper function. In this disease, myotonic dystrophy, that transition from infancy to adulthood is changed, and that many tissues are not allowed to progress from that infantile state to the adult state. And it's actually a mosaic, a composition of tissues in which you have some proteins which are still infantile, fetal is what we call them, and some which are adult-like. And so that mosaic of having some proteins which are fetal proteins and some proteins which are adult proteins, we think actually causes the disease. So as the expansion mutation increases in the gene, we believe that leads to a loss of function of these proteins we call muscle blind. So muscle because obviously muscles are affected, and blind because you develop cataracts. So the disease really boils down to a loss of function of these muscle blind proteins. So we thought that if we could replace these proteins, express them again like they should be expressed, then we'd overcome this barrier from the progression of a fetal tissue to an adult tissue, and myotonic dystrophy patients then would express normal adult proteins.